Welcome to the Audrey Hall Show. I'm your host, Audrey Hall. Today's show is about weight loss treatments. And according to the Center for Disease Control, over 71% of Americans are overweight, with nearly 40% falling into the obese category. And the CDC calls it a national epidemic. Obesity increases the risk of some debilitating and deadly diseases, including diabetes, heart disease, and some cancers. So why not just cut back on portions, exercise more, and lose weight? Well, overweight people get that question all the time, but there is so much more to it. While today's program will certainly be informative, it's not intended to be medical advice, but it is intended to provide information about some of the options that exist. And anyone seeking guidance on weight loss should talk to their doctor first for professional advice before taking any medications or pursuing any treatment for weight loss. Today, we'll be hearing from 3 people who've been treated with surgery, medication, or both to lose weight. And they'll be joining me after my first guest, Dr. Angela Fitch. Dr. Fitch is the co-founder and chief medical officer of KnownWell, a weight loss clinic in Needham, Massachusetts that takes a comprehensive whole person approach to weight loss and healthcare. Dr. Fitch is also the current past president of the Obesity Medicine Association, the former associate director of the Mass General Hospital Weight Center, and on faculty at the Harvard Medical School. She's board certified in obesity medicine, internal medicine, and pediatrics, specializing in adult and pediatric obesity treatment and prevention. So welcome, Dr. Fitch, and thank you so much for being here. Dr. Fitch, you specialize in treating the chronic disease of obesity, which the Center for Disease Control considers an epidemic. Yet in society, it's often not accepted as a disease. Why is there a lack of acceptance?
Well, Audrey, this is a very good question. It's really the billion-dollar, trillion-dollar, whatever amount of money you want to put on it, question. And I think it is really what's changed, though, is changing as we speak, and for all for the better. I think, a lot of it comes out of the bias and stigma of this idea, like since there's data from as far back as, Hippocrates was our first official doctor, and that was 500 BC. Okay, so that's before Christ, not before COVID. And, even then there's documentation of him saying, the way you treat obesity is by eating less and exercising more. And so there's always been this feeling that it's just the person's fault that they have this condition, right? And that if they could only live better, if they could only live differently, that they wouldn't have this condition. And we know now from science that that's not the case at all. Just like it's not the case for heart disease, it's not the case for diabetes. There's certainly lifestyle factors involved with all those conditions, hypertension, chronic kidney disease, all of these problems that we have in the world of diseases, chronic diseases, relate to lifestyle to a certain extent. But at the other hand of it, there's a disease process going on. There's something abnormal that's happening between our genetics and our environment that is not exactly the way we want it to be. And then that's causing the disease or causing the uptick in the disease. And it's really multifactorial when it comes to obesity, but yet it has been pictured as this, just this fault of the patient or this fault of the person with the disease, which we don't place on a lot of other diseases. And so I think that's what we're finally understanding a lot more, is that science behind the disease. And
how much does the food industry weigh into this? I mean, I hear what you're saying, but is it all on the individual, or you quoted history, but is it the food industry as well, or not?
Well, it's everything, right? It's our environment. It's a lot of things in our environment that have changed. We saw the obesity rates. If you look at the rates of obesity in the US, it's a very classic graph where it was pretty flat. Around 10% of the population had the disease of obesity, even back in probably Hippocrates' time. I mean, there were pictures of people that had, lived in larger bodies, even, long times ago, right? Before McDonald's or before, fast food.
Good point.
Or processed food. But then in the 70s, 80s, was when, late late 80s, was when the rate started to take off, and the graph goes, like straight up and is still going up, right? And so this relationship between the environment we've created, which has not been only just ultra processed food, especially, right? So we use those terms today because there's been more research that has shown that definitely there are effects of ultra processed food on the human body that are not positive, right? And so again, we have to understand that, but we also have to understand That's the environment that we created for various reasons. We needed to be able to feed a lot of people. We needed to be able to feed people quickly. We needed to feed them efficiently. And that was not going to happen with small family farms on the corners at the time that we made that decision, to do that. So economically and environmentally, we decided to go with what we went with, right? And again, this is where we're going to need some change, just like we have changes going on with climate change and other types of, issues in our country, in our environment, right? We need some change in our environment for the better from a health perspective, whether it's breathing in, toxic, fumes, from all the things we're doing, in our world, or whether it's the ultra processed food environment, and it's also, we're more sedentary. I mean, because we have more cars, right? And we don't walk as much, we don't move as much as we used to. But that's not still not the fault of the person, right? I mean, that's the environment that we've created. And if you create an environment, that's where humans live, is in the environment, right? And then the environment creates something, in relationship to their genetics. And that's what that has to happen at the same time, but that can't be the only reason, right? It's not just one
Right.
reason, which is just, get rid of the soda, right? I mean,
Right, right,
um,
right.
you know,
There's so much blame on people that have excess weight and live in larger bodies. There's so much blame that society puts on them, and in saying, just get it under control. What do you suggest people do in terms of dealing with that type of blame? And is it warranted?
Well, that's the thing. That's what I'm trying to get across, right? As a disease state, it would say it's not warranted, right? Like, we don't not offer people treatment for lung cancer who smoked. We don't not offer people treatment for, like a liver transplant who drank too much alcohol and are now in remission, right? So we recognize there are certain problems that certain people have, in certain circumstances, but we don't blame them necessarily or not offer them, comprehensive empathetic care, for their disease state. We counsel them on the fact that they need to stop smoking, for example, if they have lung cancer, but not all lung cancer is caused by smoking either, right? So it's just one risk factor that plays a role in that disease state. And then we treat the disease in front of us, right? And we try to make it better. And that's what
Right,
we've come about today to recognize is that when you look at just doing a lifestyle intervention, once you have obesity, so once you have a dysfunctional storage of fat, that's what obesity is actually. It's dysfunctional. People don't want it. They didn't ask for it. They didn't say, please, I'd like to gain more weight, right? Um,
right,
and it's dysfunctional. It's happening even though a lot of my patients, will say, I'm working out 5 days a week, like more than me, and I'm doing this, I'm doing that, and I'm still not noticing any difference, right? The scale's not budging. And this is the disease process part of it, right? It's like the same way when people are changing their diet and they're exercising and their blood pressure's not better and they need a
right.
medicine,
I've
right?
never heard anyone refer to it as a dysfunctional storage of fat, and that's exactly what it is. And how so there are programs, there are weight loss programs, there are medications, there are surgical procedures. How do people decide what to do when they have this dysfunctional storage of fat?
Well, and that's the value, I think, of what we're understanding about the treatment stages today, right? The tools we have in front of us, just like we have, as doctors, we always have to learn something new all the time, right? When new antibiotics come out or new diseases, COVID happens, we have to learn how to treat that and learn about it as a disease state. We all are learning about obesity right now too, together. Patients and clinicians, right, are learning about it together. And I think asking your doctor and someone who I think one of the challenges is because it has been so stigmatized and less access to this treatment, the issue is that patients are now accessing it very episodically in methods that might not give them the comprehensive care that they deserve or they need, right? And if you're accessing something via a 4-minute survey on the internet, that's probably not the exact care that you need from a chronic disease standpoint. And so talking to your clinician, someone who or have a long-term relationship with ideally so that you can, take care of yourself in the long run. Because this is a disease process you're going to have potentially for the rest of your life, right? And how you're going to manage that is a shared decision-making process, we call it, which means in healthcare, I help to tell you, Audrey, like what your options are for treatment, and then you help to you decide, what treatment you want to employ and how much also the key understanding we have to understand is that, how much result we're going to get from that treatment. The other issue in the world we have today is everyone thinks that people lose 20% of their weight with some sort of diet and exercise program. When the data shows that only about 5 to 10% of people are able to do that. And that's not because the other 90% of people are failures. They feel like failures. They say something's wrong with me because I'm not losing 20% of my weight. So 20% of your weight, for example, if you're 250 pounds, is 50 pounds. That's not unreasonable to think that you would lose 50 pounds doing, like a Weight Watchers or something or some other type of program. That's what people think. But only about the data shows, the science shows, only about 5 to 10% of people are able to do that. And so when I educate patients about that, they say to themselves, wow, I didn't realize it was only like, I guess I'm not so bad after all. Like, I'm not one of the 5%. Okay, well, it's hard to be one of the 5%. We all can't be one of the 5%. There's only 5% of people. But again, it's important to note that if you're not one of the 5%, it's not because it's your fault, right? This is a disease process that you need to then understand what your treatment options are, whether that's surgery, whether that's medication, and the idea that if you employ one of those treatments, again, you need this care and supervision for the rest of your life, not just something episodic. Because
Mhm.
even with surgery, human bodies gain weight. Okay. And if you gain even, the average person gains 1 to 3 pounds a year. Okay. If you do that over 10 years, you're gaining 30 pounds, right? And then 30 pounds later, 40 pounds later, you're like, wow, I gained a lot of weight, but you didn't do it. You did it like a pound a year, like you didn't do it
It's
like
gradual. It
overnight.
kind of creeps up on you, and then you're stuck with it, and you don't know where to go, and
Right. And you can't
it
get rid
never
of it.
seems to come off as easily as it comes on, right?
Exactly. And that's because we are designed that way as humans. I'm a chemical engineer by my undergraduate training. I actually became an engineer before I was a doctor. And, so that's kind of my fascination with metabolism, right? Is that from that sort of engineering approach. And when you're engineering a car, right? You don't engineer it to fly. You engineer it to drive safely on the road. You make it so that the defaults are that it's going to drive, right?
Hmm.
And so this is what we're engineered like as humans. We are engineered to gain weight. Gaining weight is the normal process for us so that we don't die in the wilderness. And that hasn't changed just because we don't live in the wilderness anymore. And
Hmm.
and that is what we have to learn how to manage and figure out, what are your goals? What are your personal goals? What are you looking to achieve? And then is the treatment that you're going to do realistically going to get you there, right? And again, you can try to be one of the 5% of people, but if you're not, you have to recognize you need to then decide if you're going to just be comfortable in your body the way it is and be at peace with it? Or do you want to change it, meaning you want to consider taking a medication or having a surgery or both even chronically, right, for long-term treatment, which is what we do with lots of other diseases. We do that
What
with
do you,
heart disease,
right? What do you think are some of the more effective and progressive treatments for weight loss in America today? What are you excited about?
Yeah, so surgery is really our most effective treatment that we have today. Just like it is for, say, certain cancers, right? To have surgery is the most effective treatment. Nobody wants surgery. I say to my patients all the time when they come in and we'll talk about like, have you thought about having surgery? And the first thing they say is, well, I don't want surgery. And the first thing I say back is, no one wants surgery. If I'm in a room full of 100 surgeons even, and I ask them all, who wants surgery today? No one raises their hand because nobody wants surgery.
Right, right,
But
right.
if I said, if you need surgery today because you need your appendix out, because your appendix is broken, right? I mean, most people would say, yeah, I'll have surgery today, because my appendix is broken. And I know that that's how you fix the appendix is by just taking it out, right? And so we have the most effective treatment is still surgery today. And that's what we have to recognize, right? Now, it's a process to go through and it's a more intensive thing to do to have surgery, right? Of any kind. And so
Right.
you have to recognize that and then you have to decide, right? Our medications are becoming much more effective, but then you have to stay on those medications for the rest of your life potentially, or there might be something new down the road. I mean, we might not, I don't think we'll be on these same medications that we're on today, potentially, you know, because we'll have new medications, right? We'll have medications that people might have to take once a
Right.
month.
And whether it's surgery or medication, there are always going to be side effects. I mean, there's the
Correct.
issues of nutrient absorption, there's the issue of mental health, the
Right.
impact on mental health, there's the issue of side effects, health side effects.
Right.
How do you weigh all those different pros and cons?
Well, that's this shared decision-making process, right? That we do a lot in other disease states, especially take, for example, cancer. We're sort of, halfway decent at that in healthcare with cancer treatment because we know the outcomes, right? We can say to a patient nowadays with breast cancer, for example, with specialized tests and like, gene tests and everything, just, family history and genetic markers on the tumor itself. This is your best treatment. And with this treatment, your 5-year survival is expected to be this, right? And these are expected to be the side effects of that. And it's going to be hard, but this is the reward you're going to get in the end. That's where we need to get with obesity treatment, that we're not there yet because there has been a lack of research, a lack of funding, at the national level towards obesity because of the bias and stigma, because obesity is not a standard benefit on people's insurance plan, despite what you said earlier, right? We still don't treat it as a disease. I mean, like as a society,
How are we
like
going to change that?
well, we're hoping small changes, right? Meaning the Treat and Reduce Obesity Act is before Congress right now as we speak. It's been there for 12 years as a bill. And I posted on one of my social media feeds the whole "I'm just a bill," from the days of Schoolhouse Rock, right? Those are the days that maybe some of our members
Right.
will, some of your viewers will remember. But if you're not that old, there's this song about being a bill and on Capitol Hill and sitting there for a
Exactly.
long
Well,
time.
12
Well,
years
this
12 years means it's getting closer, I would
Yes.
hope.
Well, and it's really gotten close recently. So the Ways and Means Committee just recently put it through committee. And again, the sit and then wait to go to committee, right? And so it
Mhm.
went through committee. So it's hopefully going to get passed, hopefully, fingers crossed. And that Treat and Reduce Obesity Act is really going to say that Medicare needs to cover obesity. Because Medicare has not covered obesity treatment, it's been considered a carve out for all the other commercial plans because the commercial plans say, well, we don't need to cover it because Medicare doesn't cover it. And so when Medicare covers something, then it kind of sets the standard, so to speak, of the nation. And so the hope is that that will also help, right?
This bill, is there anything that you'd like to stress the public do to help get support, or does it need more than that?
Well, there's been a lot of support. I've been lobbying in multiple. The Obesity Action Coalition is the patient advocacy arm for obesity. So if you feel passionate about this topic, if you're one of the 140 million Americans with obesity in our country, join the Obesity Action Coalition, nonprofit, group, really trying to, move these sorts of things forward and write your senators and say, hey, we think this should be a standard benefit. I mean, if all the 140 million people of us got up and said, hey, we're not taking this anymore,
Right.
insurance company XYZ, it should just be covered, it doesn't mean that all of our expensive medications need to be covered, first line, right? But it does mean that we need to have coverage, at least basic coverage, to be able to go in and talk to somebody about it, right? And
Well,
get that support that you need from a dietitian, from somebody who's knowledgeable about some of the ways that you can work to change it in a lifestyle fashion, in a chronic disease fashion, right? At Known Well, we're really focused on how do we take care of patients, forever, right, in their lifetime, because we recognize that this is something that's not just going to go away, with a pill or with an injection or with a surgery, in just one episode, right? It's
right.
it's it's not like your pneumonia that goes away when you take antibiotics, right?
Mhm.
It's something that you have to deal with, forever, and that's the goal is to manage that in an empathetic, caring, comprehensive, longitudinal way.
Well, thank you. You've really provided some great perspective and insight. I greatly appreciate that. I think people will find it incredibly informative, and the work that you're doing is helping so many people deal with this chronic disease that seems to not get the attention and resources that it needs. So you're making inroads, and I want to thank you so much for taking the time to talk to me today and to join me here on the Audrey Hall Show. Dr. Fitch helped clarify why obesity is a complex chronic disease that for many should be treated with more than just diet. For more information about Dr. Fitch and her medical practice focused on providing comprehensive weight-inclusive health care, go to knownwell.health. And coming up, we'll hear about the experiences and journeys of 3 guests who each chose different medical treatments for weight loss. We'll be right back.
Even the mighty might not see it coming. It's prediabetes, and it captures 1 in 3 adults. But you can escape. Take the 1-minute prediabetes risk test to know where you stand and prevent or delay type 2 diabetes. Be your own hero on smartphones everywhere at doihaveprediabetes.org.
We've all seen the ads and read about celebrities who have successfully lost weight using medications like Ozempic, Wegovy, Mounjaro, and Zepbound that have become so popular. According to a CNN article, neither Ozempic nor Mounjaro is specifically approved yet for weight loss. The Food and Drug Administration approved them to treat type 2 diabetes, but some doctors prescribe them off-label for weight loss. Wegovy, which was approved in 2021 for obesity, contains the same key ingredient as Ozempic, called semaglutide, while Mounjaro uses a slightly different one, tirzepatide. Joining me now is Kim Kamatis. She lost weight using a GLP-1 injectable medication. So thank you so much for joining me, Kim. I'm so glad you're here. And most importantly, before we get into any depth on this topic, we first really want to understand how you made your decision to take that route.
That's such a great question. So how it all started was during the pandemic. During the pandemic, I stress ate. And like my go-to was donuts.
And you and everyone else in the world.
Yes. And my life, it has been, you've known me, up and down, up and down. I lose weight, I gain weight, I lose weight, I gain weight. And I was just sick of it. It got to the point where I couldn't even move my neck because my chin was so big. And I was like, I have to do something about this. And I was watching TikTok all the time, like everyone else, right, during the pandemic. And that's when I first saw about these injectable medications. And so from that point, I never heard of them. I didn't understand anything. I just did a ton of research. And a lot of it was on TikTok. And I know for every person, you need to talk to your doctor before using any of this medication.
Right. But it's, it's like any other channel. If you heard about it on a news channel or whatever, it's just that TikTok is newer and it's different. And so, people may not think it has the same level of credibility, but it's been around for a while now and it's been building up a big following. And so you see a lot of things on that are about current evolving trends and information on TikTok. And it goes into depth because it's video.
Exactly. And there were professionals, doctors on TikTok at the time. I just did a ton of research. And, for each person, each medication is going to affect them differently. So that's why I say it's super important to talk to your doctor and check your labs and check everything to make sure that it works for your body. And so that was the thing. I needed to go through a family history to find out, was this medication going to be okay for my body, right? And each person decides that for themselves.
Like, did you have any other conditions that might be impacted by taking the medication? Was there any concerns you might have for adverse reactions? Just anything in your medical history had to be clarified.
Right. And I don't recommend this, but at the time the medication was brand new. Nobody had heard of it. I knew no one who was taking it, and decided to get it prescribed from an online doctor who's certified and everything and can prescribe. So what they did is they collected labs from my doctor. I had just had a physical, so I sent them my labs. And they looked it over and they did a family history and all the checking and then determined that I was a candidate for this medication and prescribed it. And so at the time, like I said, it was very early on, and there was nobody knew about it. Nobody was taking the medication, so there was no issue for me to have access to the medication.
Sometimes it feels a little scary to being first, and doing something that early when there's not a lot out there. Were you worried about that?
I wasn't because I had done my research.
Okay.
The GLP-1 injectable medications have been on the market for a while, even though they have been used on people. So long-term effects, that had been studied, not extensively as the newer medications came out, but they did have some GLP-1 medications. And so I felt for me, the risk-benefit analysis, I needed to do something. I was home. I figured I could always stop, but I wanted to try it.
Okay, so I've heard that you start at a low dose and move up. What was that process like?
That's correct. So you start at a low dose and you're on that dose. Again, it's a discussion with your doctor because the medication is new, relatively still. The doctors aren't even in agreement on how and when to move up. Some doctors will tell you, stay on that until you plateau, right? So you'll start to lose weight, and then you are at the same weight. And then they'll say, okay, you can move up then. Some doctors tell you to be on it just for one dose, which depending on could be up to 4 injections. So for 1 month, you'll stay on one, and then the next month you'll move up. But it depends. That's
But it's closely monitored is what you're saying.
That's right. Yeah.
Okay. And with that, when you start changing the dose, how does that feel and what do you notice in your body?
That's such a good question. And that's where I say it comes down to the individual. Some people have side effects from the medication. It's not, what is it, a magic bullet? Is that what it's called?
Sometimes people call things a magic bullet if they think it just cures something like that.
Exactly. And I don't personally believe this medication is. There's lots of things you need to do in conjunction with the medication. You still need to eat right. You still need to get out and move your body, however you move your body, right? So if you're not doing those things, they can have side effects. The medication can.
If you can do those things when you're on the medication, why can't you do those things without taking the medication? What's the difference?
That's another great question, because the medication works in conjunction with eating, in conjunction with. So I have done those things alone and have not had the same results as I've had with the medication. Because the medication, the way that the medication works is it makes you feel like you don't need to eat, right? So first of all, there's no food noise. Nothing's telling you, I'm hungry, I need to eat. So you need to make sure that you're able to eat, be proactive, right? And get the protein in. And even that is like you have to shop ahead of time so you don't get sick.
So you're saying it kind of shuts off that whole desire to, or that thought, the thought of eating all that you have frequently, even when you're trying to cut back and watch your diet and you're thinking about food, you kind of lose some of that?
Yes.
Okay.
Yeah. And it's the most amazing feeling. And I didn't realize how strong it was until it was gone.
Interesting.
The other thing it does is it slows down your digestion. Sorry, can't say that word. It slows down your digestion.
Yeah.
Right? And so you're fuller longer. So you're having these proteins and you're full and you stay full, which is awesome.
Now, one of the things I've read about is that in slowing down the digestive process, doctors are thinking that there may be some risk of stomach paralysis. Have you heard of that?
I have. I've heard of some of the side effects, right? And that you need to talk to your doctor about this. And again, you need to determine which medication is the best avenue to go for you.
Always know that there are some side effects.
Right, because that's obviously not going to happen for everybody.
Right. It's like when you pick up a prescription, and there's like a page this long. Do you read it? Do you not read it? Do you consider it? You need to really look at that and think about your own health. And what about, the lifestyle changes that go along with this? Did you have to make lifestyle changes?
Like what?
Well, just in terms of how you prepare your meals, do you exercise? All of those different types of things is sleep a factor? All the things that create a healthier environment for losing weight.
Yes, everything on the medication, everything. My whole lifestyle changed. It has to change, even just going out with your friends and everybody's ordering these big meals and you order a meal and you're like, oh, you can only eat just a little bit. You know what I mean? And the same goes when you're cooking the big family meals. You're not eating as much. It definitely is a lot easier to walk now.
You just feel, I mean, your
Just
body is
lighter.
healthier overall, right?
Just
When you take that
lighter.
weight off,
Right.
it's just improving your overall health. What's the commitment that you have to make in order, and are you still committed to it?
Oh, so I'm not. I've actually stopped taking the medication about 2 or 3 months ago
After losing how much weight?
after losing about 60 pounds.
And why did you stop?
Because I moved up in a dose and I got sick. And that was the first time that
Any
had
side effects?
side effects. Yeah, that was the first time that had ever happened.
And so you just stopped?
In a year, yeah, I don't advise that.
That was not, that's
don't-
probably not the way that it's recommended.
It's
Okay.
definitely not
Okay.
recommended
Yeah.
that way. And I wanted to restart the medication,
Mm-hmm.
and I had issues getting the medication
Now I've heard
because
about
it's
that.
all back ordered.
Yeah.
Yeah. And so that was it. Once I had the issue, I couldn't get it anymore.
Have you gained weight since then?
I haven't.
Okay.
I haven't. It's been about 3 months. I think it goes up and down like 3 pounds,
Okay.
but
And what are you doing to prepare to go on it again, or are you planning to go back? You said you
I
want
would
to.
like to go on it again. I just felt so much better. There's also studies that show that it reduces inflammation in your body, and I definitely noticed that. I feel so much better on it, but I have to restart. Once I was at the higher end of it because I had been taking it for a year or so, and now I need to start over at the very beginning. So I'm curious. I was obese and I'm still overweight, so there's still more to do. And I read you'll be on this medication for your whole life, and I don't have a problem with that. I'm on other medications, less,
Right.
which has been amazing. But if I have to be on it my whole life, I mean, I have to wear glasses my whole life.
Good point.
So,
Good point. But your health is what you're most focused on,
Yeah.
and this has helped you a lot. Wow. Well, that's so important for other people to hear and to know that they have a lot to consider in deciding whether or not to embark on this journey. And you've certainly helped people get more information that they may need in making their decisions. So thank you so much for doing that and for being here. Appreciate it.
thanks, Audrey.
Okay. As you heard from Kim, weight loss medications can have side effects. There are health risks, and also they are not covered by insurance yet. It's important to consider your overall health and the commitment you need to make before taking any medication. According to the Mayo Clinic, medications aren't a quick fix or magic pill for weight loss, but they can help people make necessary lifestyle changes to lose weight and improve their health, and it is recommended that they are used under medical supervision. Coming up next, one woman's surgical journey to weight loss and better health. We'll be right back.
Everyone has a ritual, that small thing to keep us focused.
A habit we never skip, to clear our minds and elevate our performance.
But what do you do to keep your head in the game? To drown out the self-doubt and support your mental health. Because being your best isn't just about taking care of your body.
It's about taking care of your mental health. Discover the resources that you need to keep your mind focused and your mental health a priority.
Dr. Fitch stated earlier in the program that surgery is an effective treatment for weight loss. Gastric bypass surgery is a procedure that uses special staples to create a small stomach pouch about the size of an egg to bypass some of the small intestines, so it physically restricts food intake. And Sarah McKeown chose to have that surgery, and she's joining me here today to talk about that. Welcome, Sarah.
Hi.
How did you make that decision? Surgery is a big decision.
It was. After college, I had been an athlete growing up my whole life, playing sports, intramurals in college. And then after college, the weight came on when I really wasn't playing the sports as much and could eat whatever I wanted. And by the time I was in my 30s, I had been experiencing some other health issues that were clearly related to the up and down weight. My relationship with food, my emotional eating, as some might call it, became problematic. I was able to successfully lose weight with Weight Watchers a number of different times, but I never really tackled the entire decision of not just what was the weight and the numbers on the scale, but also the choices around eating, what I was eating, when I was eating, how much I was eating. And it ended up with me having a diagnosis of diabetes just about 3 years ago. And then just again, the up and down weight loss resulted in some health issues aside from that. And then I ended up in the doctor's office in April, just over a year ago, hooked up to electrodes, doing an EKG because they were worried that I was having a heart attack.
Whoa.
And while I was sitting in that chair, I thought to myself, I don't know how I let myself get this far again, knowing that I could be successful with the weight loss, but I knew that there was more that I had to do besides just stepping on the scale and looking at numbers.
Absolutely.
I had a couple of friends that had gone through weight loss surgery, including one who went to the specific center where I had it done. So being able to talk to people that I know and trust and hear about it firsthand really made a difference for me. So I made an appointment initially in May of last year just to kind of look at the place and meet the people and see what they were about. And right off the bat, I knew it was the right decision for me. It was just a matter of choosing which surgery to go with. But the team that I worked with out of Emerson and Dr. Doyon and everybody on that staff, they were so supportive from the very beginning, answering all of my questions, letting me know that yes, there were certain things I would have to do, milestones I would have to hit before being approved for it, but knowing that would set me on the right trajectory forever.
So Dr. Laura Doyon was your doctor
Correct.
at Emerson Center for Weight Loss. That's in Concord, right?
Correct. Yep.
Okay. And did you meet her when you first went in?
I met her when I first went in so that she could give me the insight as to what my options were, because it was between the gastric bypass and the sleeve.
Okay.
And in my case, again, because I was at the time diabetic, the gastric bypass has just a higher percentage of patients actually often reversing their diabetes diagnosis.
Were you on insulin at the time?
I was not. I have not been on insulin, but I do the finger stick and diet controlled. But again, knowing what my potential for, getting worse with the diabetes or not taking care of this right off the bat, I'm at a place in my life where I just wanted to take control of my habits, my eating, all of it. And it really just all sunk in that they didn't just, again, not come from the numbers and the scale and the weight loss, but everything else around it. Like,
what was it that they did that helped you become convinced that surgery was going to be the right option as opposed to continuously trying to do it on your own?
They listened to me. I had many questions because, again, a lot of people would ask, well, you could do this with Wegovy or you could do this with Ozempic and just keep doing the exercise. I felt, because I had already been through a lot of this journey, and the fact that they were very, very detailed about what it entailed for me. Like, it wasn't just meeting with the surgeon, it was meeting with a dietitian and a nutrition. It was meeting with a mental health counselor to make sure that everything was being dealt with, not just the weight loss, but everything around it, because it all coincides, it all intersects. And so the fact that they were very positive, they were very, detailed in all of their explanations with me, and just made me feel safe in the decision that I was making. And knowing that, even when the surgery happened, that wasn't going to be the end of it. It was going to be a continued, for the rest of my life, checking in, life changes, food and drinking changes. And I think that really just my personality and me coming in with the openness and the fact that they met me with that same openness made me feel like there was absolutely no doubt this is what I felt was the right thing for me.
And they explained that this procedure, this surgery is going to change your organs and your stomach, your digestive system, everything. Yeah.
I was going to say, I teach first grade. And so a lot of the science behind it was very helpful to have the diagrams and the pictures and the repetition for me to really understand. Because when I tried to explain to people what exactly it was going to do, I often felt like I was leaving out a bit of it. But I knew, from the moment when we broke down what the options were, what the sleeve looked like, what this looked like, I felt 100% comfortable with this decision.
Okay. And so now you have a smaller pouch where the food enters. And how does that feel? And what does that do to you physically on a daily basis?
So there were very specific time frames that I had to follow leading up to the surgery, and then also certainly after the surgery. Liquid diet for 2 weeks, what I referred to as the mush diet, and then like slowly reintroducing soft foods like tuna, chicken salad, and then right in time for the holidays, perfect timing, I was able to start eating everything again. And that's been an adjustment because there's a syndrome called dumping syndrome, that if I eat something too quickly, or if I eat too much of it, or if there's a seasoning or something to it that my body's like, nope, not yet, I will throw up within minutes. And I feel it coming.
Has that happened a lot?
It's happened a handful of times, but I've been very, very careful about what I eat and how much I eat. And so I even went out to dinner a couple of weeks ago with a friend, and we ended up splitting an ice cream dessert. And I knew as soon as I got home, oh, yep, the ice cream dessert was a mistake. Like, that was a little much. Not that I can never have it, but again, it's not even quite a year yet since surgery. So I still have to be mindful that I'm very early in the recovery and the evolution of my new physical self.
So it's been just over a year for you. Almost a year.
Yeah, it'll be a year in August.
How much weight have you lost, and does your journey continue? How does it continue?
I've lost 82 pounds.
Congratulations.
It's been amazing. And I am hoping to hit my goal weight this summer. And then when I hit that goal weight, I'm giving myself a little bit of a window to lose a little bit more. That would just be the bonus. And hoping that, as that continues, I've maintained the same eating, drinking, knowing that if I have too much, this is the price I'm going to pay. But just again, trying to be mindful of what I eat, what I drink, how much. And I do have more work to do. Like, just because I had the surgery and it's been hugely successful does not mean that I'm just fixed and cured. And no, this is going to be a lifelong dedication to making sure that I maintain my health. I had this joke, all along that, like, for the second half of my life, I don't want to be tethered to bad foods and bad dudes. But like the food part is what I truly have control over, because I make my choices and I need to be responsible and own those choices. And having the surgical team that I've been able to call with questions as I've had changes occurring to be able to say, this is normal, but I wanted to just verify, go through it. They've been on the receiving end, very, very supportive the entire way. And I actually will have my 1-year anniversary on August 17th next month, and I'll have my 1-year check-in, and everything has been going amazing. But that doesn't mean that I get complacent. Like, I have to always, be mindful of what I'm trying to do.
And so your lifestyle had to change.
Yeah. The best example is, going away for like a weekend or I was away just recently in Philadelphia for a convention, and instead of like mapping out going out to restaurants, I actually ended up going to the grocery store and buying some of my own food so that I could make things for myself during the day and not worry about like going out to eat every single time we have to eat a meal. And if I do go out to eat, it's just being mindful again of what the choices are and recognizing I'm often going home with leftovers now, which is a good thing. But also just not rushing and eating a little bit slower and not shoveling it all in. Like, sometimes, one of the questions that they ask me is that living alone, I'm not having conversation over a dinner table. It's me and my cats, and like, they don't say much, but like, just being mindful of not eating too fast, not rushing. And that's a healthy tidbit for anyone, but, especially for somebody in my case. And so it's just mapping out again and knowing ahead of time what to eat, what to think about, and what not to.
And how about the diabetes?
So the good news is, as of January, I got off of the diabetes medication. I am on the trajectory of reversing it. And when I go in next month, they told me that if my numbers have stayed down, that now off the medication, that I have succeeded in reversing it. So we shall see.
A huge change, a huge accomplishment.
It's amazing, like to know, like, and not to be, and again, a lot of it comes from not doing the snacking and not eating the things that brought me there in the first place. Like, I'm still having treats here and there, but my tastes have also changed a little bit. And that has been helpful to one way or another. But again, just being mindful that that's going to be a continual work in progress for me.
And how about your care, your continued care? What does that involve on a long-term basis?
I wanted to be, and I have been, more physically active. Being able to go back to the gym and not get winded walking upstairs, to be able to chase my students on the playground. Like, they know if I wear sneakers that Miss McKeown's going to be chasing us on the playground today. Like, little victories like that we call the non-scale victories. Those are huge because, again, it's not just all about the numbers that show up on the scale. It's everything else you're able to do.
And they track you closely?
Yep, they check in. Mm-hmm.
And you check in regularly?
Yep. If anything changes, if I have some sort of change with my body that I'm not familiar with, and I pick up the phone and give them a call, like, they've been amazing. And when I go in, I still check in with the dietitian every few months, and they really want to know what you're eating, what I'm drinking. I've become obsessed with the protein shakes. They're actually really good. So it was a matter of just getting my, I always say my heart and my mind caught up, and this was necessary. I needed to tackle it from all angles.
Well, thank you so much for sharing. I think it's going to help a lot of people understand that this is an option that's available.
And it's been so wonderful.
Wishing you continued success and good health.
I appreciate it. Thanks.
For more information about the Emerson Center for Weight Loss in Concord, Massachusetts, go to emersonweightloss.org. My next guest's weight loss journey also included a surgical procedure, different than the one that Sarah had, and now his doctor is also treating him with an injectable medication. He'll be joining me right after this break.
I don't know why you're so sad. You've got a roof over your head.
You gotta stop with that depression stuff. That's what white people think. You alright?
It just feels like it's coming from everywhere.
Do you want to talk about it?
You can talk to me if you're feeling sad.
Whenever you need to talk, I'm here, okay?
Sleeve gastrectomy surgery is a weight loss surgery that removes a large portion of the stomach to restrict food intake and help patients feel full after eating smaller amounts. And in January of 2021, Ricky Finley had that surgery, and now his doctor added the injectable medication Wegovy to his treatment plan. Thanks so much for being here, Ricky. How and why did you make that decision at first to go for surgery in order to help you with weight loss and whatever other health issues you were experiencing?
Well, first of all, thank you, Audrey, for asking me. At first, like I told you, I was hesitant, but I felt it was important to share my story, and hopefully it'll help someone else when make a decision for what they want to do.
I hope so. That's why we're here.
Yeah. But getting to what you were asking me, to make the decision about the surgery, during the COVID, I was probably at my highest weight, almost up to 300 pounds, heaviest I've ever been. Taken several medications, had sleep apnea, so I was being monitored. Blood pressure was getting high. I was on the Simvastins, the sleep apnea, wearing the thing, and just wasn't feeling good about myself. And COVID hit, and then I was talking with friends, my good friend Phil Ottaviani, and some other people about ways to do things, and he had suggested reaching out to this Dr. Suzanne Wisnier at Newton Wellesley Weight Loss Center and just having a conversation with them as to what to do. And so they had a whole program, not just for the sleeve, which I chose to have, elected to have the surgery, which was a life changer for me, but there's other options that you can choose. I chose the sleeve because I felt that, I was invested in trying to change my life, a healthier lifestyle. And the option was it would be a smaller port of, your stomach. They bypass it with a sleeve. But I didn't get the whole other, there's a whole switch thing that you could do, because I wanted to go out and still live life. If I wanted to have a beer or alcohol, I wanted to be able to. I also have other ailments like arthritis and things that if I'd done the full thing, I wouldn't have been able to take ibuprofen and certain things.
What do you mean the full thing?
So there's a whole turn and gastroscopy switch. I don't know the name of it that you can do. I only did the sleeve portion of it, which gives you more options in life. So in choosing that, when I made that decision, I met with Newton Wellesley Hospital, and we met with the nutritionist first and just started talking about how to change things. And they have to make sure, before you even commit to doing it, make sure you're committed to doing it.
What does that mean? What does that commitment entail?
That commitment is just talking about some of your nutritional values, changing some habits, what you do and what you don't, writing down the daily things you eat, your intake, so they could try to evaluate what you're doing wrong, the types of food you're eating. And then they kind of, the way they approached it was, and of course it was hard during COVID, was because you started doing the Zoom meetings after you had the one meeting in person, was even if you lost a pound a week or a month, you're leading in the right direction. And that's kind of what led me, because I was starting to get depressed, all these other things with injuries. I had back surgery that I was facing. The doctor wanted me to lose weight with that, So that's why I chose Newton Wellesley, because there was several options, not just to do that. They had the nutritional value, the others. So there's something for everybody, like they always say. And so the Wegovy wasn't really out there at the time. This was an option. And so I chose that option, and she said, you'll gain back some of that weight, but it's okay. And at points you have to reshuffle the deck, which is assessing, which we'll get into, which is kind of what I've had to recently do.
Were you afraid to have surgery for this? Did you think it was a drastic step, or did it feel right?
It was a drastic step, but I felt the time was right. At night not sleeping properly, all these medicines, high blood pressure, not breathing. Having a family, wanting to be part of it.
Right.
And it was starting to really affect my life.
Did people say to you, you can just go on a diet, you can just change what you eat and lose all that weight? Did you get some of that?
Friends and people always, but, this is a lifelong thing with me. I've always been, overweight, since a child. And, I've lost 60 pounds out of whack, and then I gained it all back. I did that HMR diet, which is fantastic. That's another option that Leonard Morse Hospital has a whole program too. Worked really well for a long time for me. But this is what I'm saying. There's so many things you can do.
But this was more permanent, is what you're saying? You feel like this was
This is more permanent decision, because they change it. Your eating portions, you get full real easy, and they educate you how to do it. So before you're going to eat, they tell you either have a drink before you eat and then wait 15, 20 minutes before you eat, or reverse it, eat and then wait 15, 20 minutes before, so your stomach has a chance to digest what you do. So
and how has your body reacted to the surgery? Do you feel that it's worked the way it was supposed to? Do you feel there's been any side effects or risks? What do you think?
No, the biggest thing is listening to the healthcare professionals who've gone through it and the support group. Newton Wellesley has a great support group. Even people that don't can come in and listen. And they have pep talks. I kind of talked to you before and after, and it's a lifelong thing. You can.
Who did your surgery?
Dr. Suzanne Wisnia out of Newton Wellesley.
And are you still in touch with the same doctor on a regular basis?
So
or is it
I'm at the point it's follow-up if I want. I have not followed up in probably the last year. I'm now following up with my regular physician, which kind of switched over to the next gear of the Wegovy.
Okay, so your regular physician, your general physician, now has put you on weight loss medication.
Yes.
Okay. And how do you feel on that?
I feel great. I gradually worked up till you get to the maximum dose. Same thing. People think you make a life change, even like getting the sleeve. You still need to follow up with your doctors. And that's key to the success, and having allies to talk to. And my doctor, he was wonderful, said, hey, Ricky, you put a couple pounds back on, I'm checking the blood work, I'm checking this, you really need to make a lifetime change. You made that change and you've lost it, but to maintain it. So that's basically what I've come on as a maintainer to go, and I'm proud to say I'm at the point now my BMI is now no BMI anymore.
Well, it's very low is what you're saying.
Yes.
So what about the sleep apnea? Is that gone?
It's totally gone. I'm off the Simvastatin for the cholesterols, the blood, all that stuff I'm off of.
You look a lot different. You lost a lot of weight.
Like I was explaining to you, I have trouble when I go to the bank. They don't believe my license that it's me. The picture that's, at the bank is it's your driver's license. It's totally changed.
How much have you lost?
So it's all in all, it's about 120 pounds.
You lost a whole person.
I feel much better too.
That's
walking
great.
Around much better,
That's so good. Well, how has what about the availability of the medication, the expense of the insurance for the surgery? How has all of that impacted you financially? Has it all been covered?
So I've been lucky. I've had good health insurance, and I think that's key to everyone, because you hear of all these people. It costs about anywhere from $1,000 to $1,500 that they're going to the aftermarket to pay, or if they pay directly to get the Wegovy or any of those other brands. So I'm lucky. I just have to pay my copay. Which is, I believe it's like $25.
Oh, that's wonderful.
Every time.
Wonderful.
But get to your point about getting the medicine, as you know, earlier on in this year, there was such a hard time getting it because there's so many people on it. They're not manufacturing enough. I had trouble getting I got the first dose, but I couldn't get the second dose. And so it's just coordinate. You really have to call the pharmacies around your local area. I've had really success with Walmart and Framinghams where I'm actually getting it from. But you kind of got to keep calling around to who has it available. And now it's readily available. But the first and the second dose are the toughest, what I've found from talking to people.
These are injectables? This is the injectable you're taking now?
It's simple. It's just like an EpiPen.
Did it help you lose more weight after reaching a plateau, so to speak, or?
Yes, because I was gaining a little bit of weight back, and I had to go back and, like I say, reshuffle it up, watch what I'm eating and certain things, certain foods, and you should stick to a lot of that, and the small incremental eating is key to this.
When you had this sleeve surgery, what actually happens to the part of your stomach that's not being used anymore?
So they actually bypass it and build a whole new, they'll call it a baby stomach. Essentially, I have a baby stomach now. And so it can only process so much. And you start out after the surgery with just having like a little bit of Jell-O, and then you digest, see how you do it. You start out, my friends used to laugh at me. I'd buy those, the peanut butter in the cups there, like a 1 tablespoon or whatever, and that's all I could eat, but it would fill me at the time. And people were like, that's unbearable. I'm like, no, it's not. I'm really getting full off of that.
And about the nutrients, is your body still absorbing, I should say, all the nutrients that it needs?
It needs, but one of the risks, and they tell you, is I take a multivitamin and to do it for the rest of my life. And getting back to absorption, I'm sure the doctor talked about a little bit, is your body doesn't absorb all, say, would be your medicines or pills the way a normal person might get a good portion of, but won't totally get everything. That's why the multivitamin is important.
So if there's any issue with your needing medication for an unforeseen condition in the future, will your body process it differently, or do you have to worry about whether or not you can take other medications?
I wouldn't say I have to worry about it. The doctors are pretty up to date. Okay, these could be side effects. Let us know if there are. And I've been lucky I haven't. Like I say, I had back surgery. It's I have spinal stenosis. Had a spinal fusion after I'd done the sleeve, probably 5 months afterwards. And that's where you kind of got to be careful. I have muscles like spasm I'll have the rest of my life, so those medications, just making sure everything is okay with it.
What's your advice to anyone who feels that they need help, that they can't just take this on themselves, that they need help? My advice would be reach out to your local doctor and a local weight loss center. Like I say, I think the world of Newton Wellesley, but get it in a support group. That's what's really made me successful, being in a support group and friends, talking to them. It's okay. I mean, yes, obesity is something that people suffer with for their life. It's just like being an alcoholic or being that. It's through no one's fault. It's kind of the way your body is, and you learn. And as you know, stress does a lot of it in life too. It sure does. Well, congratulations on all your success and your good health. Thank you. And thank you so much for sharing your story. My pleasure. And hopefully this is, showing this will show people it's okay to try something, to do something. Because there are, maybe the surgery might not work for them, but getting on it with the nutritionist might work, or other options, or the medicine. It needs to be treated as the disease that it is. Yes. Yes. Yeah. Thanks, Ricky. Thank you. By hearing from all of my guests, it should be much clearer that obesity is indeed a disease. And as Dr. Fitch said earlier, obesity is a fat processing disorder. So it's not just as simple as eating less or going on a diet. People don't become obese simply from not having willpower. So society has to put the judgment aside and relieve those who are obese of the unwarranted guilt and shame that's often associated with it. We've heard today about treating obesity with medication and surgery. One of the greatest possible advantages to treatment is an overall improvement in health. As you would with any medical condition, talk to your doctor. Choosing the treatment option that's best for you requires research and professional medical consultation while you consider all the pros and cons. And another key requirement for success that all my guests talked about is the importance of making a lifetime commitment to the treatment process you choose, which includes permanent lifestyle changes. And that kind of commitment is necessary whether you're treated for just about any chronic disease. There's no magic procedure or magic medication for obesity, but it can be treated successfully. The discussions today are not intended as medical advice. If you're interested in pursuing weight loss treatment, consult your doctor first. And thank you so much for tuning into the Audrey Hall Show, where you will always learn something new.